Hi, I'm Dr. Boris, and I'm going to talk today about the differences between the saline implants that we use and the silicone implants. Many doctors are married to silicone and really feel it is really the best to put in patients. There are other doctors who feel that saline is the best to put into patients. In the old days, the silicone would break, the lifespan was short, the coating would break and the silicone would rupture and get within the capsule the body creates around the implant, or even extravasate or go further into the body tissues and even end up in the lymph nodes. And that was what was in the old days, and the concern in the old days was the possibility of autoimmune disease, cancers, and although we've not found any correlation with silicone, it was taken off the market and in 1992 and just recently put back in. It was used only in certain indicated cases, but not on every patient. Whereas today, for the last several years, people are going back to using silicone. During that time, the technology of the saline has increased, and there are doctors today who feel that the results are pretty much the same. I have patients who have a lot of complications with silicone. They get capsules, they get scalloping, and we take them out and we put either another silicone in or we put in a saline. And I have patients who have had scalloping from the saline and we take it out and we can put we can put a silicone in. But these are complications that occur with either saline or silicone. The newest silicone, even though the FDA, the government agency that monitors and controls and protects the public from having problems with silicone, feels that just like with the old silicone implants, they recommend with the new ones that every 3 years the patient get an MRI scan, and that every 10 years to replace it. The new silicone is cohesive and doesn't, if the implant breaks, it doesn't leak, it just stays within the implant. I can give you an example of that. I'm going to cut into the silicone implant and you'll see what happens when I cut into it. Here, I cut into it, and now if I go like that, you see that it comes out, but when I release it, it goes back in. Cut out, and your body forms a capsule around it, so it's not creating the kinds of problems that we had with silicone before with the new cohesive gel implants. And this is a good demonstration to show that it doesn't, when it leaks, it kind of goes back. So if you push on it, it can come out a little bit, but it just comes back in again. It doesn't just spread like molasses or like flood water, just kind of flowing out and going all over the body. So the new silicone is really a different breed of silicone than before. Whereas with the saline implant, we have the company reports a 3% rupture rate where it deflates. We've done over 12,000 and have had 10 deflations. So it's far less than what's reported in the literature. But if it leaks, and I'll show you what happens. This is a valve that we've inflated. We'll take the tubing out, and this is what goes into the body. Now, if it ruptures for whatever reason, and really these things only as I say, very rarely does it rupture, what happens is, it's just water that comes out. And your body absorbs it, and the woman wakes up and finds that her breast is deflated, comes in, and one day later, we can take it out through the belly button and put another one in. So it's not serious. It's, the concerns in the past were the dissemination of the silicone getting into the tissues. With saline, it's just water. It's very safe, and so there are benefits of using the saline because of the safety, if you're concerned about silicone. And in my hands, I think the results doing transumbilical endoscopic breast enlargement with saline gives an amazing result. And in my experience, even though I use a lot of silicone, I use saline as well. There are indications for the silicone, especially if a woman is comes in and says, I just want silicone. And because she doesn't realize that she can get just as good a result with the saline. We put silicone in. But I just want to give this demonstration so you can see the different FDA-approved implants that we have on the market. Thank you.